welcome to another Note to File. You're muted, so this is all just a mess.
We are a mess today. What's going on?
I don't know. I clicked the button and it didn't do the thing. So
Didn't want it.
I want my money back.
Okay.
My money back stream.
Good luck. Yep. I'm going to go ahead and submit that.
All right, guys. Today is August 26th. How's it going?
Yeah, it's good. It's been a crazy week, but it's been good. Busy. What about you?
Yeah, not too shabby. A lot of rain here in Oklahoma City, anyway, which is it's a little unexpected, but nice because it's been hot. So like the cool weather.
We have our Fool's Fall right now in Wisconsin. So like we always have this like weird, like you think it's going to be the next season and then it's not. So it's like mid 60s, high 60s, which is like a little chilly for August for us, but like exciting and nice. But then, it'll get hot again right when we don't want it to. But
yeah,
I'll dig it for now.
Yeah, I like it. Cool. As I said, today is August 26th. Today is a hilarious amalgam of national days.
Okay, what do we got?
Well, today is National Women's Equality Day.
Okay,
which is great, obviously.
Yeah,
huge
fan of that.
It's also National Web Mistress Day, which seems like a mixed message.
That's an interesting combo.
Seems like.
What is the explanation for web mistress?
I don't know. I didn't get down. I was just more tickled by the idea that for some reason those were on the same day. And then also, lastly, it's National Dog Day. So again, seems unfair to put Women's Equality Day and National Dog Day on the same day. But
I feel like there's something terribly poetic about that.
Perhaps so. Anyways, I hope you're all celebrating whichever day you choose to celebrate. And if you guys have comments out there, please hit us up. What's up, Christian? It should be every day. What Mistress J? Hey man, if that's what
I have so many questions, Christian.
More power to. Yeah, well, let's have Christian on the podcast. We'll do something on it. We'll really drill down on that. So cool. Yeah, it's getting to be, the end of summer, starting to get into the fall. A lot of conferences coming up. I know that you're particularly excited.
I am
about one.
I am, yeah. So
I meant Women's Equality Day. Typo.
It's a hell of a typo, my friend.
No, that's well done, Christian. Well done. Sorry to interrupt. Go on.
Oh, that's wonderful. Yeah. So I mean, obviously, it's been pretty all-consuming for me and my son, but the Veeva R&D Summit is in Boston next week, and so we're pretty much full scale getting ready for it. But it's, I don't know, I'm pretty excited. It's my first Veeva Summit. I know you were at one last year.
I went last year, yeah.
But this year, really, the focus is pulling sites and sponsors together to partner for progress, I think is like the tagline that they landed on. But essentially getting folks together to like actually talk, ideally, and like, yeah, about software, but also just about the holistic experience and relationships, which I think is important. Software can be a tool in that, but I think just having those conversations is important. So I'm excited for it. We'll be hosting a game show about sponsors and sites and how well they know each other, and having lots of different workshops and stuff too. And we'll be podcasting. Yeah,
we're doing some interviewing and podcasting from the event as well. I do. Last year was cool. I think I do appreciate how they try to get sponsors and sites like together in a room. Which is awesome. And I feel like there's sponsors at conferences and there's sites at conferences, less so, but not oftentimes are they sort of like not forced, but like given an environment to actually just like talk to each other. And so I liked that last year. It seems like they're going even more like ramping up, trying to make that.
Yeah. So I mean, there's going to be panels and like the normal stuff you see at conferences. I think the things that I'm particularly excited about, there's going to be a workshop on Tuesday, which is bringing sponsors and sites together to sort of workshop together and like solve solutions and sort of have like some solid blocks of time together. And then there's going to be like a get to know meet and greet type situation, which I think they did last year as well, but it's kind of like it's probably a bad way of describing it, but like speed dating between sites and sponsors to sort of connect some of those relationships and basically saying, hey, sites are here, come in and meet the sites. And I think That's kind of just a unique thing as well. And then like dinners, networking, and all the normal things. But to your point, I mean, the concept like this is free for sites to attend because that like it's hard, especially in this climate, for sites to fund like conferences. I think I talked about it last week, but like conferences are expensive as hell, and so it's like, how do you get people to them? That's tricky. So making it free for sites has been the goal. And
it is hard, and we need more. We need more sites at these things,
just in general.
It's great. But for sure. Speaking of that, so that is September 2nd through 4th, and then in Boston. Speaking of sites, if you're on the West Coast, SOS, we're doing a regional meetup in Irvine. That's on the 6th. If you're need any info, you can go to saveoursites.com or just hit me up. But pretty cool. We're starting to do some more regional events out there, for sites in different areas. This will be in Irvine. So
again, I think that's a similar thing, right? Where it's like no cost for sites to attend, and it's bringing the conferences to where the sites are, which seems like a smart move. So.
Well, I think it's nice. You can do it relatively inexpensively and let the sites just come for free. Get a few sponsors involved, whether they be like true pharmaceutical sponsors or vendors or whatever the case may be. We've seen some interesting things. I mean, some of the people who sponsored us, like recently, there was I think it was Delpha who did a big raise for, their company. So I think it's good. These people getting out, talking to sites. I think, again, it's good for everybody. Exciting stuff. Okay. Lastly, we'll also be podcasting from Innovation Network Gathering October 8th and 9th. We've got like a special registration link. So hit us up if you're interested, especially if you're on the site side. You've probably already heard us talk about Innovation Network Gathering at length, but
because it's one of the coolest conferences out there.
It is really cool. And I'm not going to go too deep. If you're interested, a few weeks ago, we had on Jeff and Michelle, who are, co-founded that conference. So check it out. If you want to come, reach out. We'll get a link to you. We can get you probably a little discounted entry. Don't tell Jeff and Michelle this, but we can probably get you in for less than the registration price. Very cool. Well, let's just jump in. I don't know. We kind of threw these together last minute here. So
what do you mean?
Speaking of Veeva, and you can feel free to, if you need to recuse yourself from the Veeva conversation. But I found this interesting. It is from, I don't know, a week or so ago that IQVIA and Veeva announcing a long-term clinical commercial partnership and resolution of all disputes, which I think if you've been keeping up, it looks like there's been some maybe contentious legal disputes between Veeva and IQVIA around data theft and or anti-competitive practices. I don't know all the details necessarily, but I think it's promising.
No details.
I think it's promising nonetheless that we're seeing partnerships like this. These are two big companies, right? Who potentially have the ability to actually make, big differences. And I don't know, I didn't frankly read a whole bunch of the detail here as to what these partnerships might mean.
There's a lot of different ways partnerships can be structured, but in general, I think the concept of this, right, of like the large organizations deciding to work together as opposed to in flagrant competition with each other is going to just benefit the industry holistically across the board. Like, I don't know. I think a lot of organizations tend to be very closed when it comes to working in partnerships because they're scared that it's going to infringe on their growth potential or whatever the hell their focus is, right? But I think the more we can do stuff like this across different organizations, different companies, the better.
Yeah, I tend to agree. And again, two big boys in the industry. So you would think that would mean the bigger potential for, some bigger actual impact here. So I think that's exciting. So great job. Everybody's best friends now.
Just get the guitar out and Play Kumbaya.
Yeah, get the campfire going.
Get your guitar, Brad. I'll make a fire. Make it happen.
I'm on it. Something else that came up across the feed was WCG unveils a clinical trial training solution to cut deviations. So, interesting. We have another training solution out there. This is, I guess, called Total Training. Great. Powerful name for a training platform.
I mean, I couldn't really figure heads or tails of this outside of the fact that it looks like it's an LMS. Like, let's get another learning management system.
That may be the case. They're offering various training formats such as virtual, live, hybrid, and on-demand sessions in a single cohesive platform, which sounds like most other
every single other LMS I've heard of.
Interestingly, let's see here. The Total Training solution has demonstrated a substantial impact on operations, including a decline of 35 to 50% in protocol deviations and a 40% reduction in the time taken from initiation of site to first subject screened. It's also achieved an average content engagement of 97% among staff at the trial site, supporting more than 500,000 clinicians across 100,000. Those are a lot of numbers. So this sounds like it existed.
Well, so that was
I
have two things here then, because they're unveiling it, but yet they have all of these glorious, wonderful statistics saying how wonderful it is. So if they're unveiling it, how does one have these statistics? Doesn't seem like it's unveiled. The other thing is, and I learned this in undergrad in my stats class, is you can make stats mean literally anything you want. So
I mean, that's fair enough.
I don't know. Like, especially in percentages, I think that's always fascinating. Like, you could have 3 people and be like, that's 100% retention. Okay.
Fair. But this is 100,000 centers. I mean, that's not a...
So then they didn't unveil it. Like, I'm confused. I'm confused.
Yeah, that is a little bit confusing. Nonetheless, like, look, maybe it's great. Hopefully it's great. I hope it's great. And it solves all of our problems with training. I just think, don't snicker at that. I think it's just, another like training solution as to where there are a lot already. I'd be curious to see it though. I've not seen it because maybe it hasn't been unveiled, or maybe it has, so not exactly clear
unclear.
Yet.
I mean, you know my stance on tech though, right? Where it's like, it's a tool. Tech's not going to solve a damn thing. It's going to be a tool to help solve a problem, but that's a piece of the problem.
Well, and even then, like, the tech is oftentimes not the problem per se. It's like who's programming it terribly or who's putting bad stuff.
Well, that's actually a fascinating bit with the industry where we have the purchaser is not the user, and so the user has no idea. Like, and it could be like, maybe the tech is great and it's configured to shit, and so you think the tech is crappy as the user because you weren't the one who configured it, and it's really just configuration.
Yeah, I mean, I think that's... I've seen it. I've seen a EDC be great and easy to use, and I've seen one be terribly programmed and really hard to use. So yeah, it's still persistent at this point. So yeah, to your point, tech's not really the answer per se.
It's just
a tool to get us to the solution. Yes. We'll put it on a t-shirt or something.
Great. Your next SOS t-shirts. I'm giving you ideas now.
There you go. Cool. Anyways, we'll see. I've not seen it used. If you're at a site and you've used it, hit me up. Curious to know what it looks like. Okay. We're zooming right through these today.
I guess.
Lastly, I thought this was interesting. I say that like I'm the one who found it. You're the one who found it. That Pluto Health is launching CARE, CRE, on deck to bridge care and clinical research. Pluto Health, admittedly, I don't know exactly what Pluto Health is. My use, the way I've seen it like implemented or used, is that essentially you can use Pluto Health to pull medical records that are sort of fragmented across different places from a patient. I don't know how they position themselves, but that's how I've seen it used in like a clinical research aspect. It's built into Creo, like our CTMS. Okay. So like we can use it to request records on patients in platform, and it'll pull from a whole bunch of different places. Again, not entirely sure what's going on, like under the hood necessarily. But it looks like they're launching some sort of hub, and it looks like it's more than just clinical research. It's offering personalized health options
about like finding care gaps and giving like recommendations on.
But it looks like part of that would be giving a curated view of clinical research opportunities, which is really interesting. I mean, I think, again, we talk about it, but like how much of our, problems or whatever are due to just a lack of awareness or a lack of offering in clinical trials. I mean, I'm not convinced it's just that, but nonetheless, it's a great place to start. If we can get clinical trial opportunities in front of more patients, that can't be a bad thing, right?
Yeah, and it's like the idea of having it be like and again, we can talk about clinical trials as care as a topic, right? But like, but the whole concept of like point of care integration, where it's like as folks are getting diagnoses, as folks are getting prescriptions or treatments, like if you were to have clinical trials, there's like something to embed to say like, hey, this is an opportunity as an alternative. Because I think like so much of it is patients not knowing, but it's also providers having zero insight into what trials are happening around where they are. I mean, how many providers actually do research today? It's like 3% or something of physicians are PIs.
Supposedly 3%. Well, and even in like, I work in a hospital system, and I know that, of course, the like doctors we work with directly and research know about it, but a large percentage of the other physicians or mid-levels or nurses or MAs, they have no idea research is even going on.
Mm-hmm.
And then even if they did, there's not really a super easy way for them to know every available opportunity, given at any given moment.
Right.
So it's hard even when you sort of like are integrated and embedded and able to provide that support.
Well, and there's also not necessarily an incentive for them, because it's like they could go do standard of care and move on, see their next patient, go to standard of care, move on to the next patient. And unless it's a field like oncology where like clinical research is potentially a standard of care, basically, right. It's really like, what's the incentive to be like, hey, try this cream for your eczema, not this. And here's all these other things that we're going to have to do. And so if they're not the ones doing the research, there's really not a big incentive for that. And then again, that's even in systems that are doing research and they're aware research is even being done, let alone out in community practices where they're not even doing research. So they're clearly not going to be aware of it and getting it in. So this is an interesting one. I like the idea of making wild assumptions here, but that they're putting this potentially in the hands of the patients, where it's bringing these options directly to the patients, because providers potentially are de-incentivized because you may be referring your patients away from you, which is your revenue stream. And so if that's happening at scale, they're not going to. They're de-incentivized to engage their patients in research.
It's working with or expecting practicing physicians to be super engaged with research if they're not a PI who is, frankly, getting some sort of benefit. It's hard. It's really hard, even with those physicians. I mean, if you're an employed physician, especially, you got RVUs, you got all of your, you got your boss to answer to. And the research oftentimes becomes secondary. And then if you get further out into like the referral, to your point, space, like I've literally had doctors tell me like, well, what if I send my patient over there and they get better? Which sounds like a sad and terrible thing for a doctor to say. Like, yeah, what if they get better? That'd be great, right? Well, yeah, they're not your patient, and now you can't implant them with a device or whatever the case is. But shouldn't that be what you want to happen?
I mean, that's kind of the Hippocratic Oath, ain't it?
Well, do no harm, I guess, not necessarily let someone else do less harm. I don't know. Yeah. I mean, again, it's a sticky situation, but I think to some degree it could be at least maybe alleviated if the patient themselves were given the option directly without it coming from any one specific doctor.
Right. And I think this is interesting as well. And I wonder, then I start thinking down, like, what tooling are they actually doing? Like, they're pulling all the medical records. They're clearly using some type of AI. Probably, are they looking at non-discrete using OCR technologies? Are they then running it through large language models? And what is their, was it trained on, and all of these things? Because Past Life did this. Yeah. It's really, really tricky because of the I&E criteria. And where is that data? And you can get to a point and and maybe this is enough of a point where you're bringing to say, this is a potential option. You meet some of these criteria, but there's so much either that's in the record, depending on the technologies they're using, whether they have access to it or not. Are they finding biomarkers, and what types of records do they have? And are they looking at unstructured data and physician notes? Because sometimes it just lives in there. It's not in a discrete field. So maybe it's just surfacing enough of an option, but
even that is going to be, I think it's got to, all wild speculation, of course, as we do.
As we do.
You really can't get too in depth, unless Pluto goes out and collects every protocol that there is, because otherwise they're probably just aggregating something from what's called clinicaltrials.gov, which is not inclusive of all inclusion-exclusion criteria anyway.
Mm-hmm. So maybe it's just sites. You don't even know what sites are running the trials.
Of course. Well, that's a whole nother question here that I don't know that is well addressed. Is going to tell you there's a site down the street, and there's there are group companies out there like Power, and who, I don't know, I could see some interesting partnerships or integrations where they know where the sites are. They know the criteria maybe a little bit better than what's on clinicaltrials.gov. Mm-hmm. It's interesting. I think, again, it creates an interesting situation. I think ultimately it's still, it's not like advertising. It's just going to be there's a numbers game to it. But the more people we get it in front of, the better off we're going to be.
And that's what I was regardless, I guess it kind of depends on, success metrics for them and how they're looking at it. And I think, getting into the specifics, I have a lot of questions on a lot of these groups and companies, quite frankly. But to your point, it's more just exposure. The more exposure to clinical research we can have for the general public, the better, regardless of how specific it is. It can't be detrimental. It can't be seen as a waste of time. But if we make it just more part of the dialogue, I can't see that being a bad thing.
Yeah, no, I don't disagree. Maybe we should reach out to somebody from Pluto and
sure, yeah, just understand what they're doing and
talk about it. It's a good idea.
Look at you having good ideas this morning.
Occasionally,
once in a while.
All right. Well, very good. Anything else? We're in the last few minutes. Not exactly a super comment heavy day, so.
No, I think that pretty much covers it. We'll be back on Thursday with Dr. Daniel Fox. Same time, same place in about 48 hours.
Yeah, I'm an hour off on all of my StreamYard and LinkedIn live, so I'll try to fix those. But if not, just know they start at noon Central.
Fair enough.
Sorry, guys. Okay, well, very cool.
So yeah, we'll talk to Fox on Thursday, and then for anyone in the Boston area next week, hit up Summit.
Yeah, should be a good time, and come be on camera. Tell us what's up. Awesome. Thanks, guys. I'm going to try to hit the outro button if it works, and if it doesn't, then it's just going to be an awkward end stream. So, thanks, guys.
Good.
See you Thursday. Thanks for listening to Note to File. We're committed to continuing to bring you independent and unfiltered coverage of the clinical trial industry.
We want to talk about what you want to hear. So if you have something on your mind, hit us up at notetofilepodcast.com.